My name is Elizabeth Francis Msoka Bright, and I'm a health system researcher. Currently, I'm a social science researcher, and I've been doing research quite a number of years. So, talking about antimicrobial resistance, my experience in public health as a health system researcher is that antimicrobial resistance is a growing problem in the community right now, and people have been misusing the antibiotics, which now is endangering the coming and the growing community or population in Tanzania. So much more effort is needed so that we can risk this community, which is going to be resistant to antibiotics. As it is well known, antibiotics, it takes a number of decades to come up with a new antibiotics. So we have to ensure the antibiotics that we have, they are not going to be resistant. That means we are not going to be able to tackle the diseases using the available antibiotics. So what does the term antibiotics refer to the area of expert? Antimicrobial resistance currently is the problem, as I have already mentioned, and as healthcare workers, healthcare providers, all in all areas, all angles, we have to ensure that our doctors are treating patients according to the diseases that they have. They have to rely on the lab results, laboratory. They have to identify the disease that need kind of antibiotics, and this will prevent the resistance. But also the community need to be educated. They need to be educated because right now we have outside pharmacies whereby they are accessible to our community members. People might buy antibiotics at any point where the pharmacy is there. So that is a danger, because if you can just use the antibiotics without any investigation that indicates you to use that, that means you are misusing. As a result, you are creating resistance to these antibiotics. But also, the community needs education to know what are the dangers of these antibiotics get into resistance. That means no longer the diseases can be treated. So education is needed. Why antibiotic is a problem that need to be addressed in Tanzania public health system, and what are my opinion? I guess right now what we see, most of the antibiotics that are available, they are running out of resistance. They are becoming resistant. So you can see that patients right now are treated with the very advanced antibiotics. This is because the basic antibiotics that were needed to be used, they are no longer efficient. So doctors need to step up into the advanced antibiotics, which is also a danger, because up to that level, that means it won't take time. These antibiotics also, there will be resistance. So with that danger, there is a need for the community, as I said earlier, to be educated. The government need to know that pharmacies that have been given the permit to sell treatment, they need to be reviewed. That means people or patients who are getting into these pharmacies, they have to have a prescription from the medical personnel that they are supposed to get that medication. We have to stop the over-counter medication. So the government should come up with a law, should govern the pharmacies that they sell medication per prescription. That will just help us to tackle the resistance, which is now becoming a danger. So how do you think the campaign will be able to help the community to protect themselves from antimicrobial resistance? As part of education, the mass campaign, the larger community need to be aware that we have antibiotic resistance. So it is very important for us to set campaigns into our communities. The campaigns can help to ensure that the majority of community are aware of this resistance, are aware of the antibiotics being resistant to them. What will be the future direction for their health if this medication become resistant? So campaign will ensure that a quite larger number of the community is aware of this problem. So my opinion, in order for us to tackle the antimicrobial resistance, we need to do a mass campaign, which should be kind of prospective. That means it should not be once and forgotten. No, we should keep moving, keep educating, keep raising awareness to our community. And that raising awareness of this antimicrobial resistance continuously, it will wake our people and know that now we are alarming that antibiotics are getting to resistance, which will be a danger for this now population, but also it will be a danger for the coming generation. Talking about the project which is called the SNAP, Supporting Antimicrobial Resistance Project. This is a project that has been done much more effort to ensure that it join the hands with the government, Tanzanian government, to fight against the antimicrobial resistance. And with this project, it has set the campaign. And the most campaign that is now on, the Daladala campaign, it has really helped to raise the community awareness about antimicrobial resistance. How? This Daladala campaign, we all know that it is run by the young people. They have their Daladala whereby they have a good and loud music, whereby a lot of people board in as a transport. But not only the transport, they also get educated, because this Daladala, they have posters back on their transport, whereby it gives the community education about the importance of food, not misusing the antibiotics. So this campaign has helped quite a large area, especially in Moshi, whereby this Daladala, they are moving all over. And with having those campaigns, a lot of people now, they get to know that antibiotics resistance is a problem. So what I want to say that the education campaign that has been targeted to the public has been very efficient by using this Daladala transport, which has carried out the message for antibiotic resistance. So I would again want to say it is very important for the community to get aware of this antibiotic resistance, which now is alarming as a problem, that what we have in the healthcare system is now getting into resistance. And once we are in that danger, that means most of the diseases cannot be treated, because almost all the antibiotics will be resistant. So the campaign has helped, and I would like to say again, let us keep on moving with the campaign, because much more people will keep on getting the messages on and about the antibiotic resistance. I would like again to say more about the importance of having education campaign about antimicrobial resistance targeting the community or the public. This is very important to ensure that the community is aware of the antimicrobial resistance, which is a problem currently. So having the education campaign among the public, it will help the public to be aware, not only to be aware, but also to make sure that the use of antibiotic is as per education as per healthcare provider advice, because as we said, the antibiotic resistance or antimicrobial resistance is a growing problem whereby community or the public have now misused the antibiotics. How? Most of the community, apart from getting the antibiotics from the hospital, some of the people, they do over-counter drug. That means they can be able to access the antibiotic from the pharmacies. So having the public campaign will help to raise that knowledge that now there is a problem. And to get the antibiotics, you have to meet the healthcare provider, the doctor. He has to know what is the right antibiotic according to the problem that you suffer. So having the campaign, it will raise the awareness of this antimicrobial resistance. But why do I think the campaign will help the public to protect themselves from AMR or the antimicrobial resistance? The campaign that we have from the study, which has been run for quite almost 3 years now, called SNAP, Supporting Antimicrobial Resistance in Tanzania, it has helped so much because with the study, what we did, we use the Bajaji campaign, whereby we have our messages on the antibiotic resistance, which we use this Bajaji transport here in Moshi, and we put those messages. And we target the Bajaji which do the routes from the KCMC hospital to Moshi town, and from Moshi town to the lower Moshi. Why this area? This area is the area whereby we have a large number of population. Many people are coming to the KCMC area whereby there is a referral hospital, the KCMC. So I can say a lot of these people are the people who are accessing healthcare facility. So having this Bajaji campaign, it means most of these people who are coming to KCMC, they are boarding Bajaji, majority of them. So having those messages in those Bajaji, that means our people get awareness, get educated from this transport. And that's where our target is. And it has to, right now, as I'm speaking, majority of people, even when you cross along the street, people are knowing that there is an alarm that we have antibiotic resistance. So you can see now people are taking steps or they are taking measures to prevent the resistance. And now, as I speak as well, majority of people are coming to the hospital to make sure that their diseases are investigated before they start to use the antibiotics. So what I can say, the Bajaj campaign has helped the public because now the antibiotic resistance awareness is now clicking in their heads. They are now seeking help from the hospital instead of pharmacies. Although we still need to ask the government to still continue looking the means of governing these pharmacies so that they may not allow the use of antibiotics without prescription from the doctor. So once again to say the campaign, the Bajaji campaign in Mosh has been so helpful, and because it is a prospective education campaign which is ongoing, people are still getting education on the antibiotic resistance. So thank you very much for this conversation, and I would like to say the project should keep on moving with this campaign as much more people are still gaining the knowledge from the campaign. Thank you.